15 Alarming Signs. Your liver is screaming for help. Know the silent alerts that can save your life. Have you ever wondered if your liver is trying to send warning signals? Are those seemingly unconnected symptoms actually a cry for help from your liver? How many of these signs can you be ignoring right now without even knowing it? Your liver is a silent warrior, working tirelessly to filter out toxins and keep your body functioning optimally. But when overloaded, it begins to send signals, many of which are surprisingly subtle and easily mistaken for everyday problems. Your liver may be suffering severe damage as you go about your life normally, without heeding the warnings. Liver damage rarely comes from alcohol alone. Processed foods, common medications, and certain beverages can also harm this vital organ. Are you willing to know the signs before it's too late? Let's get started. 1. The mystery of pale stools. What is your toilet trying to tell you? When you go to the bathroom, you probably don't pay much attention to the color of your stool. This may be the first clue that something is not right with your liver. The characteristic brown hue of the stool comes directly from the bile produced by your liver. This essential substance helps in the digestion of fats and gives normal color to your daily bowel movements. When your liver is in trouble, the production and flow of bile can be interrupted or slowed down. The result is light-colored, grayish, or even clayey-colored feces. In some cases, you may notice that they float in the toilet water instead of sinking. This fluctuation happens because undigested fats make stools lighter, a classic sign that your liver isn't processing nutrients properly. If you've noticed this persistent change in the past few weeks, your body is trying to alert you to a possible early-stage liver problem. 2. Mysterious blemishes. When your skin reveals inner secrets. Have you ever woken up with purple spots without remembering getting hurt? Small red or purple spots may be telling a story about your liver. When this vital organ is congested or damaged, it produces fewer proteins needed for proper blood clotting. The result is a greater tendency to bruise and the appearance of reddish spots similar to a rash. These spots appear when small blood vessels rupture under the skin. A compromised liver can't maintain this protection, turning your skin into a visual map of what's going on internally. Recent studies have shown that up to 70% of patients with cirrhosis have some type of skin manifestation. If you're noticing these mysterious spots with increasing frequency, your liver may be asking for urgent attention. 3. Silent transformation. When your nails betray a liver in danger. Your nails may be revealing a lot more than you realize about your liver health. When your nails start to turn completely white, losing their natural pink tone, or acquire a rounded shape, it's time to pay attention. This condition, known as Terry's nails, is strongly associated with significant liver damage. The change occurs because the compromised liver affects blood circulation in the extremities of the body. 8 out of 10 people with severe liver scarring had completely white nails, making this one of the most reliable signs of advanced liver impairment. Unfortunately, many people mistake this condition for a simple cosmetic change or associate it with aging. If you've been examining your nails closely lately, what might they be trying to tell you? 4. The telltale pain. Why that pressure on the right side shouldn't be ignored. That feeling of pressure or discomfort on the right side, just below the ribs, especially after meals, is not only difficult digestion. When the liver is damaged, bile can become thick and viscous, blocking the small tubes that connect the gallbladder. The result is a feeling of uncomfortable pressure in the rib region on the right side of the body. This discomfort can even extend to the right shoulder, due to the connection with the phrenic nerve. Pain that feels muscular or bony may actually be the reflection of an internal organ, calling for help through shared nerve endings. Many patients report seeing multiple specialists to treat what they believe to be orthopedic problems, before discovering the true cause of the liver. 5. Cracks that talk. The surprising link between your heels and your liver. Your cracked heels may be revealing much more than a lack of hydration in the skin. Your body relies on vitamin B3, also known as niacin, to keep your skin strong, smooth, and hydrated. When the liver is compromised, it redirects niacin stores to repair liver damage. This leaves less of this essential nutrient available for other bodily functions, including maintaining skin health. As a result, the skin on the soles of the feet and heels can become dry and cracked. What many dermatologists don't realize is that these persistent cracks are often a visible manifestation of an overworked liver trying to prioritize limited resources. You can temporarily address the problem by increasing your intake of vitamin B3, but the ultimate solution lies in treating the underlying cause: liver disease. 6. The traitorous swelling: how your right foot can unmask a silent disease. Persistent swelling in the right foot, especially when it is more pronounced than in the left, is rarely coincidental. This intriguing sign may be directly related to the functioning of your liver. When blood flow through the liver does not occur properly, this organ can suffer swelling and increase in size. This change puts pressure on the portal vein, resulting in fluid accumulation in the legs and feet. If you press your finger against the swollen area and notice that it gets a mark that takes a long time to disappear, this is an even stronger sign. Asymmetry in swelling, affecting the right side more than the left, is a distinguishing feature that many doctors recognize as strongly suggestive of liver problems. This sign can appear months or years before other, better-known symptoms manifest, offering a valuable opportunity for early intervention. 7. The breath that no toothpaste solves. The sign that no one talks about, that persistent bad breath that doesn't improve even with the most rigorous brushing, can originate far beyond your mouth. The compromised liver often fails to properly filter toxins from the blood. When these toxins accumulate, some of them are expelled through the breath, resulting in a distinctive odor. This liver breath has a sweet, slightly mold-like smell that experienced dentists can identify. Most alarmingly, 90% of people with this symptom mistakenly attribute it to dental problems, spending fortunes on dental treatments that will never solve the real cause. Persistent bad breath, especially if accompanied by any other sign on this list, merits a thorough liver investigation. 8. Small white invaders: what these eyelid growths are announcing. Small white or yellowish growths around the eyelids may seem like just a cosmetic problem, but they represent an important warning. These tiny buildups are deposits of cholesterol that form under the skin due to the liver's inability to properly process this substance. Known medically as xanthelasmas, these growths appear when the liver is unable to efficiently metabolize cholesterol. The eyelids, because they have thinner skin, often show these signs first, being a true window into metabolic health. Most worryingly, most dermatologists treat these moles only as cosmetic problems, removing them without investigating the underlying cause that may be compromising multiple organs simultaneously. If you've noticed the appearance of these signs, especially if you have other symptoms on this list, your liver may be experiencing significant difficulties. 9. The signal in the toilet. When your urine changes color, your body is sending an SOS. The color of your urine can reveal important secrets about your liver's health. This vital organ plays a crucial role in the breakdown of red blood cells, which contain a yellowish pigment called bilirubin. When your liver or gallbladder is damaged, this pigment can accumulate in the body and be eliminated through urine. As a result, you may notice that your urine takes on a dark orange, amber, brown, or coke-like color. In addition, certain medications such as antibiotics, sleeping pills, or birth control can also contribute to this discoloration by overloading your liver. Studies show that darkened urine appears an average of 18 days before other more severe symptoms in cases of acute hepatitis, offering a crucial window for early intervention. The change in urine color is rarely temporary when related to liver problems. It tends to persist or gradually worsen. 10. The mysterious itch: why your hands and feet beg for relief. That persistent itching on the palms of your hands or the soles of your feet, especially at night, can have a surprising origin in your liver. This irritating sensation occurs due to the buildup of bile acids under the skin. When the liver does not properly filter these acids, they accumulate in the bloodstream and eventually under the skin of the extremities. This buildup leads to the release of histamines into the blood, triggering the intense sensation of itching. The symptom is particularly characteristic due to its specific location, palms and soles, and tends to worsen during the night. The most revealing aspect of this symptom is its bilateral and symmetrical nature, affecting both hands and feet with similar intensity. A pattern rarely seen in conventional dermatological conditions. This mysterious itch can precede other better-known signs of liver disease by months or even years, offering a valuable opportunity for early diagnosis. 11. Night blindness, the unsettling symptom that connects your eyes to your liver. If you have trouble seeing clearly in low-light conditions, especially at night, your liver may be sending an important signal. This condition, known as nyctalopia or night blindness, can indicate a retinol or vitamin A deficiency related to liver problems. Your liver's production of bile plays a key role in the absorption of vitamin A, which is essential for the rod cells in the eyes to adapt to different levels of light. When liver disease is present, this process can be disrupted, resulting in visual difficulties in dark environments. The symptom may be accompanied by dry, irritated, and sandy eyes, especially if the gallbladder is also congested. Surprisingly, studies show that up to 65% of patients with liver cirrhosis develop some degree of night blindness, even though many don't associate it with their underlying liver condition. If you need to constantly increase the brightness of your phone screen at night, or have trouble driving in the dark, your liver may be trying to tell you something important. 12. The telltale yellow, the skin transformation that should never be normalized. When your skin begins to take on a yellowish hue, you're looking at one of the most classic and alarming signs of significant liver damage. This condition, known as jaundice, occurs when your liver doesn't effectively filter bilirubin from your blood. The accumulation of this substance leads to a change in skin color, resulting in a characteristic yellowish tone. Jaundice usually begins to appear subtly in the whites of the eyes before spreading to the skin of the face and body. This condition is a clear indication of major liver damage, which can be caused by hepatitis, cirrhosis, or intoxication. The most worrying aspect is that when jaundice becomes visible, liver damage may already be at an advanced stage, having progressed silently for months or even years before this outward manifestation. Jaundice should never be ignored or considered a normal variation of skin coloration. It is always a sign that something is significantly wrong. 13. Maps on the skin. What spider veins are trying to show you? Small red veins that branch out like cobwebs on the surface of your skin may be conveying an important message about your liver. These formations, known as spider veins or telangiectasias, resemble small red dots with extensions similar to spider legs. They arise when blood vessels are damaged because your liver isn't effectively filtering out excess estrogen. High levels of this hormone can weaken the blood vessels in the veins, leading to their appearance on the skin. These marks tend to appear more often on the upper trunk, face, and neck, areas with a higher number of estrogen receptors. The most telling aspect is that spider veins usually disappear when pressed and quickly reappear when the pressure is removed. A simple test you can do at home. When found in groups or in increasing numbers, these vascular formations are rarely benign or purely cosmetic. 14. Zero energy. When unexplained tiredness has a surprising cause. That persistent fatigue that no amount of coffee or sleep seems to resolve may originate in your compromised liver. This unexplained tiredness is often the first sign of a liver problem, appearing long before more specific symptoms. Your liver plays a crucial role in energy metabolism, storing and releasing glucose as needed to keep your energy levels stable. When this organ is overloaded or damaged, its ability to regulate body energy is significantly compromised. Liver fatigue has distinctive characteristics. It tends to be more intense in the second half of the day and does not improve with adequate rest. The most insidious aspect of this symptom is that doctors and patients often mistakenly attribute it to stress, depression, or simply the pace of modern life, missing a crucial opportunity for early diagnosis. Liver fatigue can also be accompanied by difficulty concentrating and reduced ability to perform tasks that require sustained attention. 15. The belly that deceives, distinguishing fat from a serious warning sign. An increase in abdominal volume that seems disproportionate to the rest of your body can be much more than simple weight gain. This condition, known as ascites, occurs when fluid builds up in the abdominal cavity due to increased pressure in the hepatic portal system. Ascites is particularly insidious because in the early stages, it can easily be mistaken for normal weight gain or temporary bloating. Unlike regular abdominal fat, the swelling caused by ascites tends to be firmer, tighter, and often accompanied by discomfort. A distinguishing feature is that this type of swelling usually develops relatively quickly, within weeks or months. The most alarming aspect is that when ascites becomes visually evident, it usually indicates advanced stage liver disease with significant impairment of portal function. If you've noticed an unexplained increase in your waist circumference, especially if accompanied by other symptoms on this list, it's crucial to seek immediate medical evaluation. Rescue Protocol: How to reverse liver damage before it's too late. The liver goes through 4 distinct stages of progressive damage: fat accumulation, inflammation, scar tissue formation, fibrosis, and finally, cirrhosis. Fortunately, this organ possesses the remarkable ability to regenerate completely when given proper care. Recent studies show that even livers with up to 70% impairment can regain normal function with the right interventions. The liver is the only internal organ capable of regenerating lost functional tissue instead of just scarring, making it possible to recover even after extensive damage. Let's explore the most important steps to reverse liver damage and restore the health of this vital organ. First, improve your diet by drastically reducing your intake of sugary, starchy, and flour-based foods. Breads, cookies, pastries, ketchup, pancakes, pasta, and soda are particularly harmful to an already compromised liver. A fatty liver responds to fructose in a similar way to alcohol, further supercharging its metabolic functions. Researchers have found that eliminating sugary drinks can reduce liver fat by up to 25% in just 2 weeks. This simple dietary change can be the critical first step in slowing down and eventually reversing the process of liver damage. Second, incorporate bitter and sulfur-rich foods into your daily diet to support liver regeneration. Leafy greens, artichokes, radishes, garlic, broccoli, Brussels sprouts, kale, cabbage, mushrooms, and onions are powerful allies of your liver. Foods rich in sulfur increase levels of glutathione, the most important antioxidant for liver health. Glutathione acts as a potent natural detoxifier, helping the liver eliminate toxins and reduce oxidative stress. The power of these medicinal plants goes far beyond basic nutrition. They trigger specific biochemical processes that stimulate the regeneration of damaged liver cells. Third, start your day with a cup of organic coffee, adding a teaspoon of turmeric powder to enhance its effects. The polyphenols present in coffee and the phytonutrients in turmeric are effective in reducing the formation of scar tissue in the liver. Research has revealed that people who consume coffee regularly are up to 50% less likely to develop liver cirrhosis. This simple morning ritual can do more for your liver than many prescription medications, reducing markers of liver damage by up to 30%. Additionally, consume at least 1 liter of mineral water throughout the day to help thin your blood and support your liver in producing bile. Fourth, include specific healthy fats that directly support liver cell regeneration and reduce inflammation. Extra virgin olive oil, avocados, walnuts, flax seeds, and wild-caught fish, rich in omega-3s, are particularly beneficial. Oleic acid, abundant in olive oil, has been shown to reduce fat infiltration into the liver and improve insulin sensitivity. Omega-3 fatty acids significantly decrease inflammatory markers and improve liver enzyme function. The key to recovery lies in the complete replacement of harmful fats with these therapeutic fats that activate metabolic pathways of cellular repair. Completely avoid omega-6 rich vegetable oils like corn, soybean, canola, and sunflower oil, which promote inflammation. Fifth, implement regular periods of intermittent fasting to speed up the cleanup of damaged liver cells. Restricting your eating to an 8 to 10 hour window a day allows your liver to devote more energy to repair processes. Fasting activates autophagy, a mechanism by which the body identifies and eliminates damaged components, particularly beneficial for liver cells. Intermittent fasting is possibly the most potent intervention available for reversing liver damage, capable of initiating measurable changes in as little as 2 weeks. Start gradually, perhaps with 12 hours between dinner and breakfast, and progressively increase as your body adapts. Bringing your liver back to life. The path to full recovery. Your liver is largely responsible for more than 500 different functions in your body. When this vital organ begins to fail, the entire body suffers the consequences, often sending out the warning signs discussed in this text. The good news is that with the right interventions, applied consistently, most liver damage can be reversed. Continue to observe your body with increased attention, looking for any of the 15 signs we have discussed. If you identify 2 or more of these symptoms, consider scheduling an appointment with a gastroenterologist for a thorough evaluation. Simple blood tests like ALT, AST, GGT, and bilirubin can provide valuable information about the current state of your liver. True transformation happens when you take full responsibility for the health of your liver, understanding that every food choice has a direct impact on your regeneration. Remember, your liver doesn't feel pain due to the absence of sensory nerves, which means damage can progress silently. This is precisely the reason why the subtle cues we've discussed are so crucial. They're often the only early clues. Think of your liver as an essential filter that, when cleansed, allows your entire body to operate at optimal levels of energy and vitality. Get started today by implementing at least one of the strategies we've shared, adding the rest in the coming weeks. Your liver will thank you, and you'll feel the difference in every aspect of your health and well-being. The time to act is now. Your liver is waiting for the chance to show its incredible ability to recover and regenerate. Are you ready to give him this opportunity?